Whenever I ask a patient whether they believe if nutrition has a lot to do with human health and disease, they almost always answer in the affirmative, stating, "Of course, it has a lot to do with human health and disease. It has everything to do with human health and disease, absolutely," etc. These types of answers are the ones that I get to that question. And I agree with such a thing. Obviously, nutrition has a lot to do with human health and disease. There's a problem. Number one, nutrition does have a lot to do with human health and disease. And number two, doctors are supposed to be experts in human health and disease. Now, where's the problem? The problem is, I'm not sure if you realize this, but the typical doctor, the vast majority of doctors you see and you work with, talking about medical doctors such as myself, the amount of training they have in nutrition, the scientific principles of nutrition, etc., and thus the experience they later get, is basically nothing. There's no training whatsoever. If a doctor during medical school had one class, that would be amazing. Usually they don't even have that. So what does that do? What problems arise from that? Well, obviously, if you've never been trained in something, you're not going to know anything about it. You're not going to know how to scientifically manage nutrition in patients because you've never been taught it, such things. The other problem is, I think subconsciously, that doctor's not going to think human health and disease are really that well connected to nutrition. It must not matter because doctors, like all of us, we enter medical school and residencies and do our training, and we come in there with certain amounts of intuition and life experiences, and we believe, like most people believe, nutrition has a lot to do with human health and disease, and then we're not trained in it at all. So what does that subconsciously or consciously suggest to us? It must not be that important. Regardless, the doctor is not going to have training. Now, what ends up happening? The patient still knows that nutrition has a lot to do with human health and disease. Their doctor can't aid them. So they start doing it themselves. And the problem with that is there's no scientific principles being undertaken whatsoever. I mean, not everyone needs certain things. Not everyone needs certain types of medications, right? Well, not everyone needs certain types of nutritional interventions. So whenever you read these things about, oh, this nutrient works great, it doesn't work great in everybody. Only works great in those people who need it, and if they need it, if it actually works in them. These are where science can be very helpful, and the doctor should be trained in order to help them with this, and they're not. So how do I differ in this issue? Well, number one, even though I wasn't trained in it during medical school and residency, I've subsequently been trained, and I have ongoing training with much of it actually with experientially with my patients and determining individually what works best for those people. So what I'd like to do for the rest of this discussion is just to give you some examples of how scientifically evaluating nutrition and dealing with it can really get to roots of problems people are experiencing. Now, if an individual has a nutritional deficiency, there can be one of three major reasons for it. By the way, what we're talking about right now is micronutrient deficiencies, okay, just to distinguish that from macronutrient issues. Macronutrients would include basically, protein, carbohydrates, and fats, things think of as calories and energy. And we could have a long discussion about that, but we're talking right now about micronutrients, vitamins, minerals, cofactors, etc. So let's say a person has a deficiency of a particular micronutrient. For example, they have a low magnesium level. Now, interestingly, this is just as an example, low magnesium can lead to all kinds of symptoms that many people commonly experience. For example, you can have a person who has fatigue. You can have a person who has muscle aching. You can have a person who has inflammatory issues. You can have a person who has insomnia or anxiety. You can have a person who has high blood pressure or blood sugar issues, which are kind of medical problems, let's say. You can have a person who has problems with palpitations or a high heart rate. You can have a person who has constipation. These are or memory issues. Now you can imagine how a variety of people have many, if not all, or many, most of those problems, and they might be treated pharmaceutically with multiple different drugs for their memory or for their blood pressure, for their pulse, or for their blood sugar, for their sleeping, or for their constipation, or for their aching, or for their inflammation, etc. All of those are due to low magnesium. So imagine what really should be done. Oh, and by the way, as an aside for magnesium, and discussing the importance of that, talking about medications and medical problems, mentioning again blood pressure. Well, the most commonly prescribed class of blood pressure lowering agents is a type of pharmaceutical drug class called a calcium channel blocker. So what does this drug do? It blocks this thing called a calcium channel. Well, if there's a calcium channel blocker, then there's a calcium channel, right? What is this calcium channel? It's a passageway in the membrane of a cell, right, that connects the outer world from this inner world of the cell, and normally calcium passes through it, right? So this drug blocks that calcium channel, and by doing so, it can lower blood pressure, can lower pulse rate as well in certain situations. Well, calcium channel blocker is the most widely prescribed pharmaceutical drug. And so if there's a drug that blocks the calcium channel, that would suggest that there's a non-drug, right? That Mother Nature, God, has something there that blocks this calcium channel. Guess what it is? It's magnesium. So the natural calcium channel blocker is magnesium. So imagine how many people who have high blood pressure and are taking blood pressure lowering agents, calcium channel blockers. Actually, a lot of their problem has to do with low magnesium. Amazing. Anyway, getting back to the discussion. So if a person has low magnesium, it can be due, or any micronutrient issue. We're talking about deficiencies. Of course, you can have toxicities, you can have excesses, etc. We're talking about deficiencies right now. If a person has a deficiency of magnesium or whatever other micronutrient you want to throw in there, it can be due to one of three major things. Number one, it could be due to they're not having enough magnesium in their diet. They're not putting enough in their mouth. If that's the case, it's very simple. Put more in the diet, put more in the mouth. Now, you don't put too much. You'd have to measure these things. You have to see what the level is beforehand. Suppose maybe it's due to lack of appropriate intake. Increase that intake with food substances, with supplements. And then to go back later, secondarily, to measure scientifically, did that work? Is now the magnesium level better, etc. And to see how the body's responding, of course. It's one possibility. It's not the only possibility. Another common possibility is the intestinal system is not absorbing it. Okay? And if that's the case, you can give them all you want, theoretically orally, and it's not going to fix the problem, because the problem isn't not enough orally. The problem is your intestine's not absorbing it. Now, just to describe how important intestinal health is to the body, strongly connected to cardiovascular health, strongly connected to brain function and things that can lead to dementing illnesses like Alzheimer's, for example, strongly connected to the immune system. And obviously the immune system, if it overfunctions, can lead to autoimmune diseases, which trouble people, and it can underfunctions can lead to infections and cancer. So notice how understanding the functionality of the immune system really leads to some of the major causes of death in our society: cardiovascular disease, Alzheimer's, and cancer. And notice how nutrition can clue you into that. For example, one clue for a person who has an intestinal absorptive problem, and thus an intestinal problem, would be they have a low nutrient level. You give it to them orally, and it doesn't correct. Okay, so now that is a much more difficult issue to address. Obviously, you don't have to just put more in the food, put more in their mouth in terms of a supplement, for example. You'd have to understand, well, what's wrong with this intestine that it's not absorbing, and thus correct that. And then you would correct many things, including the issue with the nutrient, the micronutrient. The third reason is sometimes cells are under a type of physiologic stress. They're not functioning normally, and to try to keep up, what they're doing is they're burning through nutrients, for example, in this case, the magnesium or the whatever else you want to throw in there. Now, many diseases, if not most diseases, where they derive from is cells over time becoming dysfunctional, right? They're not functioning normally, and you don't just wake up one day with cancer. If you look at these things, you can see things much earlier cluing you into there was a problem with those cells. And one of the clues might have been a nutrient that you couldn't correct when you gave them supplements orally, so it wasn't an intake issue, and you looked and there really wasn't an intestinal absorptive issue. That would be a clue that it's the cells are physiologically stressed, they're not functioning, and they're burning through the nutrient. Of course, a much more difficult thing to assess, to look into, to figure out. But thus you see how understanding, nutrition, we're talking about micronutrients right now, is crucial. And patients can't do this themselves. You can't just, I watched Dr. Oz, forgive me, or whoever, and they talked about how great vitamin E is, and so I'm just going to start taking it. Well, what if you don't need it? How do you know it's working, etc.? And I don't blame patients, because the doctors haven't been trained and aren't interested in such things. They need to be trained. They need to be interested. And interestingly, if they would and they start getting experience, such as myself, they'd recognize many, many, many disease states. They are what you'd expect they are. They have a connection to nutrient deficiencies. Thank you.